Stop. If your feet have been swelling even a little, especially at the end of the day, I want you to pay very close attention to what I'm about to tell you because this is one of those signs your body gives you quietly at first, and then suddenly it becomes something you can't ignore anymore. Most people brush it off. They say it's just age, or maybe they stood too long, or maybe it's something they ate. And sometimes that's true, but not always. And the problem is, by the time many people realize it's not normal, the underlying issue has already been there for months, sometimes even years. Hi, I'm Dr. Thais Aliabadi, and over the years I've seen countless patients come in with what they thought was a minor inconvenience, just a little swelling around the ankles, nothing serious, nothing urgent. But when we looked closer, when we actually paid attention to what their body was trying to say, it told a very different story. I remember one patient in particular, a 68-year-old woman who told me she had noticed her feet swelling every evening for almost a year. She assumed it was just part of getting older. She didn't feel pain, so she ignored it. But when she finally came in, we discovered her circulation was struggling and her body had been trying to warn her the entire time. This is why I'm making this video, because swollen feet are not just about discomfort. They are often about what's happening beneath the surface, where you can't see it, where things quietly start to change. Your body is incredibly intelligent. It doesn't wait until something becomes severe before it reacts. It starts sending signals early. The question is, are you recognizing them or are you explaining them away? In the next few minutes, I'm going to show you a simple test you can do right now, wherever you are, sitting or standing, that can give you a powerful clue about what's really going on. And more importantly, I'll help you understand what that result actually means, because knowing is what changes everything. Most people don't need complicated medical knowledge. They just need to understand what their body is already telling them. So before we go any further, I want you to do one thing. Don't just listen. Follow along with me, because what you notice in the next minute could be something your body has been trying to show you for a long time. Now let's go a little deeper, because understanding what you're seeing is just as important as doing the test itself. I want you to sit down comfortably and take a moment to look at your feet. Really look at them. Not the quick glance most people give, but an intentional look. Then take your thumb and press gently but firmly into the area just above your ankle or on the top of your foot. Hold it there for about 5 seconds. Don't rush it. Then slowly release and watch what happens. If the skin immediately returns to normal, that's usually a good sign. But if you notice that the skin stays indented, even for a few seconds, or slowly rises back instead of bouncing back quickly, that's something we pay attention to. This is what we call pitting edema, and while the term sounds technical, the idea behind it is actually very simple. Your body is holding on to fluid, and it's holding on to it in a place where it shouldn't be staying. Now here's where most people misunderstand what's going on. They think swelling means there's just extra water in the body, like something you drank or something you ate caused it temporarily. But the truth is, your body is constantly managing fluid, moving it through your blood vessels, your tissues, and your lymphatic system. When everything is working properly, fluid doesn't just sit in your feet. It circulates, it moves, it returns back up toward your heart. But when that movement slows down or becomes inefficient, fluid starts to collect in the lowest part of your body, and that's usually your feet and ankles. Gravity plays a role here, but gravity alone is not the cause. It's the combination of gravity and reduced circulation that creates the problem. I want you to imagine your circulation like a system of highways. Blood is constantly traveling, delivering oxygen and nutrients to your tissues, and then returning back to your heart. But unlike a highway system with strong engines pushing traffic forward, your body relies heavily on movement, especially in your legs. Your calf muscles act like a pump. Every time you walk, every time you move your feet, those muscles squeeze the veins and help push blood back upward. But when you sit for long periods, or when those muscles become weaker with age, that pumping action slows down. And when it slows down, blood begins to pool and fluid starts to leak out into the surrounding tissues. That's when you start to see swelling. I've had many patients tell me, but doctor, I don't feel anything wrong. And that's exactly why this gets missed. Because in the early stages, swelling is not painful. It's subtle. It's easy to ignore. It might only show up at night and disappear by morning. But that pattern itself is a clue. When swelling comes and goes, it often means your body is still trying to manage the imbalance, but it's struggling. And over time, if nothing changes, that temporary swelling can become more persistent, more noticeable, and harder to reverse. There was a patient I saw not long ago, a 72-year-old man who was very active earlier in life, but had become more sedentary after retirement. He told me his shoes felt tighter in the evenings, but he thought it was just normal. When we did this simple test together, the indentation in his ankle stayed for several seconds. That told us his body was retaining fluid. But more importantly, it told us his circulation was no longer as efficient as it used to be. Nothing dramatic had happened overnight. This was a slow change, something that had been developing quietly over time. This is why that simple test matters so much. It's not about diagnosing a disease on your own. It's about recognizing a pattern. Your body rarely jumps from completely normal to severely abnormal overnight. It moves through stages, and each stage gives you an opportunity to respond. The earlier you notice it, the easier it is to support your body and improve what's happening. But if you wait until the swelling becomes constant or severe, then the underlying issue has had more time to develop. Another thing I want you to pay attention to is when the swelling happens. If it's mostly at the end of the day, especially after sitting or standing for long periods, that often points to circulation and fluid movement issues. If it's present even in the morning, or if it's getting progressively worse, that's when we start thinking more seriously about other systems in the body, like the kidneys or the heart, because those systems also play a role in how fluid is managed. Your body is interconnected. No single system works in isolation. What matters most right now is not fear, but awareness. This test is not meant to scare you. It's meant to give you clarity. Because once you see what's happening, once you understand that swelling is not random, it becomes something you can respond to instead of ignore. And that response doesn't have to be complicated. In many cases, small daily changes in movement, posture, and circulation can make a meaningful difference. But the key is knowing where you stand right now. So if you just did that test and noticed that your skin stayed indented, don't panic, but don't ignore it either. Take it as a signal. Your body is asking for better movement, better circulation, and more support. And in the next part, I'm going to show you exactly what you can start doing. Simple, practical things that don't require any special equipment that can help your body move fluid the way it's supposed to. Now that you've seen what's happening and you've tested it for yourself, the next step is understanding what you can actually do about it, because this is where most people either take control of the situation or continue the same habits that quietly make things worse. The good news is that in many cases, especially when swelling is still in its early stages, your body responds very well to simple, consistent changes. The key word here is consistent, not intense, not complicated, just consistent. Your circulation system doesn't need extremes. It needs regular support. The first thing I want you to understand is that movement is not optional when it comes to circulation. It is essential. Your body was not designed to stay still for long periods of time, and yet that's exactly what many people do, especially after 60. Sitting for hours, whether it's watching television, reading, or even working, reduces the natural pumping action in your legs, and when that pump slows down, fluid begins to collect again. So the goal is not to suddenly start intense exercise, but to reintroduce gentle, frequent movement throughout your day. Start with something very simple. While you're sitting, move your feet forward and back slowly, almost like you're pressing a gas pedal and then releasing it. Do this in a controlled way, not fast, not forceful, just smooth and steady. What this does is activate your calf muscles. And remember, those muscles are your body's natural pump. Even this small movement can help push blood back upward and reduce that pooling effect. Many people underestimate how powerful small movements can be when done regularly. It's not about how hard you push, it's about how often you remind your body to keep things moving. Another simple habit is standing up more frequently. If you've been sitting for 30 to 45 minutes, stand up, even if it's just for a minute or two. Shift your weight, take a few steps, let your legs engage again. You don't need a full workout session. You just need to break the pattern of stillness. I've seen patients improve their swelling simply by adding these small interruptions into their routine. It sounds almost too simple, but your body responds to patterns, and when you change the pattern, you change the outcome. There's also something very important about elevation that many people don't fully understand. When you lie down and raise your legs slightly above the level of your heart, you are essentially helping gravity work in your favor instead of against you. During the day, gravity pulls fluid downward into your feet. But when you elevate your legs, even for 10 to 15 minutes, you allow that fluid to move back toward the center of your body more easily. This can provide noticeable relief, especially if your swelling tends to worsen by the evening. It's not just about comfort, it's about giving your circulation a chance to rebalance. I remember a patient who made just one change. Every evening, instead of sitting with his feet on the floor, he would lie down and elevate his legs for 15 minutes while watching television. Within a week, he noticed that his shoes were no longer tight at the end of the day. Nothing else changed. Same diet, same routine, just one simple adjustment. That's how responsive your body can be when you give it what it needs. Now let's talk about something people often overlook, and that is how long periods of standing can also contribute to the problem. Many people think swelling only comes from sitting too much, but standing in one place for too long can have a similar effect. When you're standing still, your muscles are not actively pumping, and blood can still pool in your lower legs. So whether you're sitting or standing, the key is movement. Gentle, regular movement keeps your circulation active. Another factor that plays a role is hydration. This might seem counterintuitive, but not drinking enough water can actually make fluid retention worse. When your body senses that it's not getting enough fluid, it tries to hold on to what it has. This can contribute to swelling. Proper hydration helps your body regulate fluid balance more effectively. It's not about drinking excessive amounts all at once, but about maintaining steady hydration throughout the day. Footwear also matters more than people realize. Tight shoes or socks that leave deep marks on your skin can restrict circulation and contribute to fluid buildup. If you notice that your socks are leaving strong indentations around your ankles, that's another sign that circulation might be compromised. Choosing comfortable, well-fitting footwear and avoiding anything that constricts your lower legs can make a difference over time. But here's the most important part of all of this, and I want you to really hear this. None of these changes work if they are done once or twice and then forgotten. Your body responds to habits, not one-time efforts. The same way swelling developed gradually through repeated patterns, improvement also comes through repeated positive actions. You are not trying to fix everything overnight. You are simply giving your body better conditions to function the way it was designed to. And as you start making these changes, I want you to keep checking your progress. Go back to that simple test we did earlier. Press gently into your ankle and observe how your body responds. If the indentation becomes less noticeable over time, if it returns to normal more quickly, that's progress. It might not be dramatic, but it's meaningful. Your body is responding. At the same time, it's important to know when to seek further evaluation. If swelling is getting worse, if it's present all the time, if it's accompanied by other symptoms like shortness of breath, unusual fatigue, or pain, those are signs that you should not ignore. In those cases, it's important to speak with a healthcare professional and get a proper assessment. Early attention can prevent more serious issues later. What I want you to take away from this is not fear, but control. Swollen feet are not random. They are a signal. And once you understand that signal, you're no longer guessing. You're responding. And that shift alone changes everything. Now, I want you to take a moment and think about what you've just learned, because this is not just about swollen feet. It's about understanding how your body communicates with you. Most people wait for pain. They wait for something dramatic, something that forces them to take action. But your body doesn't work that way. It speaks quietly first. It gives small signs, subtle changes, things that are easy to ignore if you're not paying attention. And swelling in your feet is one of those signs. It's not loud, it's not urgent at first, but it is meaningful. Hi, I'm Dr. Thais Aliabadi, and if there's one thing I want you to take away from this, it's this simple idea. Your body is not working against you, it's working for you. When something changes, when something feels different, there is a reason behind it. The goal is not to panic, but to understand. Because once you understand, you can respond in a way that actually supports your health instead of ignoring it or guessing. That simple test we did together, pressing into your ankle and watching how your skin responds, may seem small, but it gives you real information. It tells you whether fluid is moving the way it should or whether it's starting to collect. And when you combine that awareness with small daily habits like moving more, avoiding long periods of sitting or standing still, elevating your legs, and supporting your circulation, you begin to shift things in the right direction. Not overnight, not instantly, but steadily. And steady improvement is what truly matters. I've seen patients change the course of their health simply by paying attention earlier instead of later. They didn't wait for the swelling to become severe. They didn't wait for additional symptoms to appear. They noticed, they responded, and over time, their body responded back. That's the relationship you want to build with your body. One where you listen and it adjusts. At the same time, I want you to remember that not every case of swelling is something you should handle alone. If what you're experiencing is persistent, getting worse, or accompanied by other unusual symptoms, it's important to seek proper medical advice. There's strength in taking action early, not weakness. It's one of the smartest decisions you can make for your long term health. Before you go, I want you to do one simple thing tonight. Take 30 seconds, sit down, and look at your feet again. Not quickly, not casually, but intentionally. Notice how they feel. Notice how they look. Because the more aware you become, the easier it is to catch changes early, and early is where you have the most control. If this helped you, make sure you stay connected with Dr. Thais Aliabadi because every video is designed to help you understand your body better and stay independent, active, and healthy as you move forward. And if you noticed swelling in your feet, tell me in the comments when it happens most for you, morning or night, because that small detail can say a lot. Your body gives you signals every day. The difference is, now you know how to recognize them.